Hi there and welcome back. Let's review pulmonary embolism. We'll get into the overview of pulmonary embolism, PE, signs and symptoms, what contributes to the pulmonary embolism, how do we diagnose and treat, what are the typical complications, and bottom line, how do we underwrite. Okay, so with that being said, let's start. PE or pulmonary embolism is a condition in which one or more arteries in the lungs become blocked by a blood clot. Pulmonary emboli usually arise from thrombi that originate in the deep venous system of the lower extremities. However, they rarely also originate in the pelvic, renal, upper extremity veins or the right heart chambers. After traveling to the lung, large emboli can lodge at the bifurcation of the main pulmonary artery or the lower branches and cause hemodynamic compromise. So, what are the typical signs and symptoms? It includes cough, chest pain, shortness of breath, excessive sweating, fever, rapid or irregular heartbeat, leg pain or swelling or both, abdominal pain, seizures, as well as lightheadedness or dizziness. What contributes to the pulmonary embolism? What are the risk factors that can increase your risk? Include prior history or family history, as this may be due to inherited disorders that affect blood, making it more prone to clot. History of surgery, and that's why med to prevent clots may be given before or after surgery, such as joint replacement, history of pancreatic, ovarian, and lung cancers can increase levels of substance that help blood clot. Likewise, history of breast cancer and chemotherapy, tamoxifen plus heart disease makes clot formation more likely. Pregnancy, smoking, supplemental estrogen, obesity, and prolonged immobility, such as long trips during lengthy plane or car trips, or being confined to bed for an extended period, say after surgery, are all considered as additional risk factors. How do we diagnose? It may require a blood test, chest x-ray, ultrasound, spiral CT scan, pulmonary angiogram or MRI is appropriate to move forward and better manage and treat pulmonary embolism. So, how do we treat? The treatment is aimed at keeping the blood clot from getting bigger and preventing new clots from forming. Prompt treatment is essential to prevent serious complications. Treatment consists of blood thinners primarily, and clot busting drugs are reserved for life-threatening situations. Vein filter and clot removal are the surgical and other procedures that may be used on as needed basis. The typical complications you will see in the medical records that you are reading to underwrite a potential customer who is interested in buying life insurance from your company include pulmonary hypertension and pulmonary infarction. Okay, so that precisely covers pulmonary embolism. And bottom line, how do we underwrite? Follow the underwriting manual that your company expects you to follow, and make sure you make the final adjustment to arrive at the best possible aggressive offer without compromising the bottom line profitability that your claims or your actuarials are telling based on the ongoing research they do in your company. And by that I mean also plug the underwriting manual with your internal company specifics. Okay, let's take a break here and see you soon. Take care. Bye now.